Okay, we're right at the top of the hour. I know I've been in the chat here with Kristen, who's coming in from England. So it just got past midnight there. I would say good morning to her, good morning back to her, and good whatever time it is, wherever you're joining us from. Welcome. So glad you're here to be a part of this discussion. This is a new topic for us, so we're really excited to get to have some great perspectives to share and to answer as many of your questions as we can. This is Diagnosis 2.0, Reprocessing Your Condition as an Adult. And we'll be getting into some conversation about what it's been like from a Marfan, Loeys-Dietz, and a VEDS perspective on that, as well as some medical or mental health background on what is fairly typical or what is known to be typical amongst all folks who are transitioning into adulthood. I wanted to start our conversation today by being sure to mention a couple of things. One, we had a lot of really great questions submitted for this discussion, and several of them were a little bit more related to finding the right doctors, transitioning from pediatric doctors to more adult ones. And I wanted to make sure that everyone was aware we actually had a webinar specifically about that just a few weeks ago. You might have missed it, and or maybe you were on that and you still have more questions. So I know this YouTube link isn't a great one to type in, so I'm going to drop that in the chat. If you're interested in that webinar, you can grab the link from the chat, or it'll also be in the description of this YouTube video once we get it loaded separately. The other thing is that if we do not get an answer to your question tonight, or if you ever have a question that you just want to hear from somebody on, or get a medical perspective on it, you can always use our Help and Resource Center. It is absolutely free. Our on-staff nurse, Jan, is just a wonderful human being. And if she does not know the answer to your question, she seeks that information out from our professional advisory board and other people to help get her the best information for you. Please use that resource. It is there for you. We want you to have all the right information that you want to have. So you can get to her via marfan.org/ask. It's also on loeysdietz.org/ask and thevedsmovement.org/ask, or you can dial in 800-8-MARFAN. And that's for questions related to what we're talking about tonight during this webinar, or really any kind of questions. So just wanted to make sure and put those out there because we will not be answering medical questions during this discussion, but we still want you to get answers to those as you have them. Getting us going here then, just briefly, I'm going to briefly mention who all we're hearing from during this conversation, and then we will introduce everyone. So we'll get all faces and names lined up. We have Brona Hagins from the Midwestern University. She's a clinical psychology doctoral student who also happens to live with hypermobility or hypermobile EDS. So she's got a little bit of extra good perspective on what it's like to have one of a chronic condition like those in our community. We have Courtney Jensen, who is representing the Loeys-Dietz syndrome perspective, Kristi Posival, who is representing the VEDS perspective, and Elijah Williams with Marfan syndrome. I will let them do their own introductions of themselves, and they're going to tell you a little bit about what brings them to this topic and a little bit about their diagnosis story as we get started. And then we're going to have a really nice presentation from Brona, giving some background on developmental steps, milestones during this stage anyway, for anyone, not anyway. And then we'll open it up for questions and other comments. If you have questions throughout this, please drop them into the Q&A on the bottom of your Zoom screen, or if you're on a mobile handheld device, you'll have to swipe over to get to the Q&A, but would love to have your questions so that we can get to as many of them as we can. With that, then I am going to stop my share and turn it over to Brona. Would you like to get us started with your introduction, and then we'll just work around the group? Oh, I should introduce myself too. I'm Angela Christ. I'm the director of the Loeys-Dietz Syndrome Foundation here at the Marfan Foundation. Okay, there we go.
Hi, Angela. Sorry, it looks like it's not allowing me to turn my video on.
Not allowing you to turn your video on.
You cannot start your video because the host has stopped it.
Well, that is odd.
In the meantime, I will pull up my presentation.
Kristi, Elijah, or Courtney, are you able to start your video?
No.
Okay.
No, I'm not.
This is a new one. I have not seen this error issue before. Okay. Okay, while I work on that, do you want to, Brona, would you like to go ahead and introduce yourself while I can?
Sure. It's also not allowing me to upload the PowerPoint. So if you could do that, that would be great.
Okay.
All right. So I'll go ahead and get started.
Okay.
All right. Hi, everybody. My name is Brona Hagins. As previously mentioned, I am a clinical psychology doctoral student at Midwestern University in Glendale, Arizona. I have VEDS, which obviously permeates my life and has influenced my passions in research and in future practice. So I'm currently conducting research on the impact of sexual functioning on day-to-day life in individuals with VEDS, particularly in the way in which gynecological concerns affect women's health. So I'm very excited for that, but most importantly, I think that my research has provided the knowledge needed for this presentation. And with that, I will pass it over to Kristi.
Sorry, I was muted. Hi, I'm Kristi Posival. I have vascular Ehlers-Danlos syndrome, and I think we're just doing introductions, so I'll just share my diagnosis story. I was diagnosed in 1979 after my father passed away. He was undiagnosed, and he died just unexpectedly one night in our kitchen, and it turned out his colon had ruptured. And they diagnosed him during his autopsy, which led to my diagnosis at age 5. So I've always known I've had vascular EDS since I can remember being alive, but there was not much known about it back then, not really until the 90s. So I spent a lot of time in the dark doing trial and error, but I did know that I couldn't take gym class. See if my video turns on. It does, yay. I could not take gym class. I could not participate in organized sports. And definitely doctors told me no children. So I did know those few things, but it wasn't until the invention of the internet that Yahoo chat rooms started, and I kind of found other people in the world with vascular EDS, and we've grown so much since in the last 30 years, but that's me.
I guess I'll go next. Hi, everyone. My name is Elijah Williams, and I have Marfan syndrome. So my diagnosis story, so my dad had it, and then I would say he was the first in our, I guess, family to have it. My dad had it, and I believe, was it 4 or 5 out of his 6 kids, his 6 children, were affected, including me and a couple of my other brothers. But yeah, so that's me. And thank you guys for participating and coming out tonight.
All right, I'm Courtney Whitmire Jensen. I am affected by Loeys-Dietz, and I was diagnosed in 2005 when I was about 10 years old. We knew something was up for the first 10 years of my life, but didn't really have a name for it because I was born a couple years too early for the discovery of Loeys-Dietz. But I was in the first 70 in the world diagnosed that original cohort. So I pretty much as far as I can tell, adult life recalled having Loeys-Dietz. It wasn't too much of a surprise or shock to me one day. It was something I've grown up with, but definitely personally experienced what I would say would be a re-diagnosis in my late teens, early 20s of kind of what this looks like across the lifetime. I am a pediatric medical genetics genetic counselor at Duke, so I kind of have both sides of the perspective here. And I also work commonly with this community, but also the community of other lifelong genetic disorders, and have done some research on this background and actually have a publication, hopefully that will be published at some point, but we'll see. So excited that you guys are all able to join us tonight.
All right, we'll get started here in just a second when the presentation gets set up.
Yes. Sorry, I have another minute here. I'm trying to get Outlook to open back up. That's where I had your presentation from. Sorry. Stand by. So sorry, everybody. Thought we had a different. Hang on. It's a PDF. We'll roll it this way and screen share. I'm going to have to show it in the PDF viewer format, but we'll still get the point. Okay, handing it over to you.
All right, thank you. So first and foremost, this is Diagnosis 2.0, so welcome. We're going to talk about reprocessing your condition as an adult, and I will be taking a mental health perspective. Give me 1 second. Here we go. Okay, we can go to the next slide. Oops. So I already kind of did an introduction, but hopefully you'll see some of my research with the Hypermobility Syndrome Association. So I'm very excited for that. But I also wanted to give a big thank you, obviously, to the LDS Foundation for inviting me to speak today and providing a space to have this conversation. We can move on to the next slide. Okay, so I wanted to provide a baseline of what developmental milestones occur when transitioning into early adulthood. I think people often assume most development occurs during childhood, but this is far from true. For example, our prefrontal cortex, that is responsible for executive functioning, which is everything from planning to organizing to impulse control to inhibition, doesn't fully develop until mid to late 20s, which means we're making vital decisions during that time when we aren't yet what some may consider are at our optimal cognitive capacity yet. So some significant developmental milestones that occur in emerging adulthood include identity exploration. So we're exploring, developing, and discovering one's identity, navigating who you are, what your purpose is, and your identity within each context, which ultimately furthers your self-development. So you're developing your self-concept, increasing self-awareness. There's physical changes. You're actually at the peak of physical functioning during early adulthood. And there's cognitive changes. So your ability to think pragmatically, utilize logic, consider practical limitations, our awareness of social influence, ability to use reflective judgment, and the development of self-esteem. We also have individualism, so understanding ourselves as an individual, increasing our independence, changing environments, and relational dynamics, which comes with increased responsibility. So there's an increased capacity to accept responsibility, as well as having increased responsibility for one's decisions, finances, allocated time and energy, and health, specifically health decisions. So taking ownership of one's part in life outcomes happens during this time. It's also a period of intimacy versus isolation. So we're developing relationships, learning how to communicate, having increased independence, and we're beginning to understand the importance of social support and the impact of isolation as our environment and access to peers changes. So this period is significant for individuals beginning to feel isolated as a result of one's condition and potentially from past experiences. So not only does adulthood come with significant stressors and life-changing decisions, but these transitions are exacerbated within the context of living with a chronic condition. So we can move on now. All right, so despite each chronic condition presenting distinct to each individual and having their own unique aspects to them, including connective tissue disorders and various rare syndromes, there are many nuances amongst these conditions to which we can relate in our experiences of stressors, such as the fear of the unknowns and a multitude of considerations, responsibilities, and limitations that may not be relevant for the average individual that exist in addition to all that naturally occurs during that developmental period. So factors that may ultimately exacerbate one's experiences of major stressors, or vice versa, developmental stressors that may exacerbate everyday symptoms related to your condition. So I think it's important to note that despite the distinctness of each condition covered today, there is empirical support for the overlap of chronic conditions that creates commonality, particularly in the impact of chronic symptoms. Shared symptoms include everything from chronic fatigue and pain to gastrointestinal and sexual difficulties, considering the heritability of the condition and psychosocial impacts. So there's also shared experiences in healthcare challenges and even hypermobility that relates to connective tissue disorders. All right, we can go on. So the research out there about the unique experiences of adults with chronic conditions is limited. However, there are some key features I'd like to cover about what currently exists in literature. That sets the stage for reprocessing your condition as an adult and highlights the relatability of experiences and long-term impacts of symptoms with these conditions to one another. I recognize that the research is slightly negatively focused, but I think that information normalizes and validates the negative experiences while allowing us to make more informed decisions to create better outcomes for ourselves. So in terms of a shared experience, one of them is a shared experience of problems that come with seeking healthcare. So this particular study identified common complaints, particularly amongst those with EDS, but I believe the results are generalizable to other rare conditions. So experiences include being ignored and belittled, being assigned psychological and psychiatric explanations, being treated as an object, having your boundaries crossed, and even being suspected of familial violence, which has led to mistrust of the healthcare system and increased risk placed on one's health by avoidance of medical care. Another study demonstrated that the experience of non-affirming healthcare can actually limit self-actualization in daily and social life. There are also current limitations in treatment and a lack of awareness and lack of research that influences our limited understanding of these conditions. There's also a mutual healthcare burden. So the burden of looming life-threatening events, injuries, and other risks, chronic pain and multi-organ system manifestations, reduced physical functioning during what's supposed to be one's peak functioning, and high health service utilization, which comes with a high financial burden and difficulty or limits in access to these resources. Moving on to life satisfaction and quality of life. One study, there was only half of participants in the study assessing adults with VEDS and LDS were satisfied with their life as a whole. So the dissatisfaction was related to vocation, somatic health, and sexual health, while low satisfaction was found to be significantly associated with severe fatigue and symptoms of anxiety. So the greatest satisfaction was found in family life, partner relationships, and activities of daily living. Overall, the study found chronic pain, severe fatigue, and psychological distress levels were moderate to high for these individuals. Another study found lower health-related quality of life on all scales in individuals with Marfan syndrome. They found low physical functioning and well-being, specifically in areas of social functioning, vitality, general health, bodily pain, and enroll limitation, such as physical limitations, which include fatigue and reduced physical endurance that had adverse effects on daily life and actually impacted ability to cope with stigma, pain, fatigue, reproductive planning, adherence to medication, and restrictions in physical activity. And overall, they found high levels of fatigue correlated with increased psychological distress. In terms of psychosocial impact, psychiatric disorders are strongly associated with chronic pain. This study looked at the EDS population, but again, I believe it's generalizable since a lot of these conditions experience chronic pain. So the study found that pain and fatigue were associated with anxiety and mood disorders, such as depression and somatic symptoms, and that emotional responses were impacted by an altered sense of body awareness. Another study highlighted the impact of psychological factors on the experience of pain. They identified that pain has clear behavioral and emotional outcomes and consequences that influence the development of persistent problems and impacts outcomes. Pain behaviors are influenced by consequences and limited by our environment, and things such as beliefs and attitudes, expectations, and our overall level of emotional distress. And a restricted life resulting from these conditions, leaves individuals feeling like they need to rely on others and experiencing fear, pain, stigma, what it's like to live with a disability, sexual difficulties, reproductive concerns, physical limitations, risk of injury, and having limited possibilities for job, education, and social activities, which forced individuals to rethink their options. A major highlight in research is what results from the chronic nature of the experience, which is fear and avoidance. So chronic pain can lead to avoidance of social activities and physical activities and relationships, and causes a fear of the unknown, such as a fear of future decline, finding reliable information, receiving support, and finding ways to cope. I do want to emphasize though that the study found positive coping methods for individuals with chronic pain to include pacing activities, practicing acceptance, finding solutions, using optimism, and seeking social support. So there is an overarching concept called activity avoidance, in which individuals were found to use a cost-benefit analysis to keep pain manageable. They assessed the worth of their activity and its provoked pain intensity, while considering the unpredictability of the pain, the exertion of control, and the emotional cost associated with the activity. Activity avoidance can develop and maintain deconditioning and disuse syndrome. Fear and anxiety influence the experience of pain and lead to avoidance learning that perpetuates pain behaviors and experiencing, resulting in negative appraisals of pain and consequences that develop into catastrophic thinking, which ultimately causes negative affectivity, anxiety sensitivity, integrating distorted beliefs about pain, and over-attending to bodily sensations. And on the other end of the spectrum, there is a risk of overactivity in individuals with chronic pain that adversely affects an individual's daily functioning. Overactivity behaviors are found to be related to one's self-concept, including feeling hardworking, successful, and a sense of achievement, demonstrating perfectionist traits, psychological inflexibility, and a struggle to accept one's limited functional capacity, which is sometimes done to avoid judgment from others or is influenced by an environment or interpersonal factors. There's difficulties in changing others' expectations and perceptions of your functional capacity, and discomfort accepting support from others, or an inability to communicate about their functional capacity and needs. So the concern here is merging one's identity, adult identity, self-worth, or self-views on a highest possible functional capacity that is actually detrimental to one's health. Okay, I'm sorry, I know that was a lot, but let's go on to the next. So from a developmental and mental health perspective, some vital considerations for emerging adulthood when living with a chronic condition include the following. These considerations are what I thought may be relevant within the reprocessing experience that occurred during adulthood when the weight of the condition begins to catch up with an individual, especially regarding limitations, and one may begin to compare their lives with others in their age range. So one of these considerations is identity and diagnosis. So whether you're seeking comorbidities or understanding the weight of the condition, as previously mentioned, with a new self-focused perspective and increased cognitive capacity to consider the long term. So having to develop one's own knowledge and seek further understanding of what implications their condition has on life trajectory, assimilating one's diagnosis with their identity, grieving the losses associated with the condition, and exploring how to form the identity you want. You have more autonomy in dictating what that identity is, and realizing you have more control of creating that identity, more than you may have thought. Consideration is access to resources. At this time, you may need your own insurance, and you have to be able to afford to pay the copays and have the financial and access to medical care, and other things such as specialties and specialists, and mobility aids and ergonomic supports, which leads into environment and accommodations. So there's major life decisions in career, social life, education, romantic relationships, and what those look like for the individual amongst what accommodations, formal or informal, they need or would like to seek out in each environment and or relationship. And I may be biased, but I think it's so important to redigest, reformulate, and reevaluate what mental health means to you within your context, your experiences, and your condition. So re-examining what it means to have mental health concerns alongside a diagnosis. So distinguishing misattribution of symptoms to psychiatric and psychological functioning from the very real significance of the mental and emotional impact of a chronic condition, as to not minimize the extent of the emotional impact while simultaneously honoring dismissal experiences that may have occurred from past medical or even interpersonal encounters. By not allowing this to impede one's own access to mental health care, you're allowing yourself to access all that it can provide. So such as understanding the role of emotions and pain management strategies, and increasing quality of life and self-esteem, and aiding in chronic stress. I think it's also important to address it's all in your head. Those statements are emphasized all throughout research. I don't believe anyone should be saying this. However, I think the reality of the statement is slightly counterintuitive, as the mind is extremely powerful and it is simultaneously responsible for everything from the pain experience to physical health to emotional health. So I believe it can be detrimental to minimize the mind-body connection and the interconnectedness of emotion and physical well-being. So recognizing its impact allows one to attend to it and address it, so the emotional impacts are manageable. This is a time where self-advocacy is now on the self. To advocate for medical care, for example, or to delegate that advocacy to loved ones, which requires having the knowledge about your condition, being able to share and communicate that knowledge, find and access reliable resources, and so forth, to be able to appropriately and accurately advocate or make decisions about your role as an advocate in the greater community. Another consideration is life decisions and reproductive health. There are major life decisions during this time, including decisions about lifestyle, medical care, such as surgeries, treatments, and interventions, further seeking diagnostic clarification, dictating whether to continue education or where you want to go in terms of career path, decisions about distributing energy, and the heritability and reproductive health concerns, I think all of which need to be conscientiously attended to and reprocessed within the context of your condition and your functioning. And then there's changes in relationships and expectations. So communicating about your condition, your needs, and your functioning. I think many individuals engage in masking, particularly those with invisible disabilities, but also in those with variable expression. So where the expectations can't be consistent day to day because the presentation is not consistent day to day. And this involves reconstructing expectations for yourself, but also others' expectations of you, assessing the risk and conducting a cost-benefit analysis based on your needs and your current capacity, and reconciliating those hopes, dreams, and general societal, cultural, or familial expectations that may no longer be a reality or may no longer serve a purpose for you. So how can you adjust your relationship with those things to create a new meaning and life goals that are realistic, hopeful, and fulfilling despite the experienced challenges? And another large one for me is, as emerging adults, your cognitive capacity shifts and creates a space in which a new perspective can emerge and a growth-oriented mindset can develop. So for adaptive demand and resiliency, I first want to start with defining stress. Stress is any situation that creates adaptive demand. I think the important word there is adaptive. So you're having to adjust and readjust continuously to environmental demands. And attending to chronic adaptive demand and understanding its impact can ensure that the chronic stress does not impede on your recovery process from the challenging life events. So being able to adaptively respond to these demands develops into resiliency, which is a significant protective factor against a multitude of risks and one of the best predictors of recovery from stress and negative psychological impacts of living with a chronic condition, which leads to growth, strength, and life meaning. And again, you're changing your relationship with what your condition means within the context of you, which can be extremely empowering. So we can go on to the next slide. So I know that was a lot. Thank you for hanging in there. I wanted to be able to cover a lot while also freeing up time for everyone to talk and create a discussion. So I'd love to open up for each of the other speakers to provide their personal, community, and client perspectives from their unique backgrounds and experiences.
Thank you so much, Brona, there is so much good information in there. And so if you, like we've said, this will be recorded, or this is being recorded, you'll have plenty of chances to go back and re-watch it or re-listen, because there's really a lot of great information in there to draw on, whether you have a chronic condition or not. And then, of course, we layer this in, right? And so I wonder if we could start with going around the panel and sharing a little bit about like what of that discussion or of that presentation most resonates or gives you like an insight into how you reprocessed or found new meaning or found an opening in your diagnosis from childhood to currently where you are as an adult or somewhere in between. Can I give that to Kristi first? We'll start there. I'm going around the circle in my screen. I don't.
So I'm answering that specific question or giving my thoughts. I'm sorry.
Sure, sure.
Yeah.
Just like what resonated with you, or what of those points highlight something that was particularly poignant in your process?
Yeah, sure, absolutely. Well, a couple of things, and just to highlight my diagnosis story again, real quick. I was 5, and I lost my father, and I saw him die. He was revived, but he died in the hospital later. But there was no hiding how serious my condition was. I mean, I started contemplating my own death at 5, right? And it's been every day since. I just turned 48. So a lot of that stuff, there's a lot of things in there that really felt like me, especially the catastrophic thinking. I'd like to just talk about briefly. I probably didn't hear that term till I was in my mid-30s. And it really helped that those two words put together really helped me identify why I get so carried away. I mean, I am not a hypochondriac. I am a chronically ill person, but my thinking gets so carried away. And I tell the story, it sounds a little morbid, but when I first got together with my husband, our first Christmas together, he gave me a kitten. And then every couple of hours, the kitten would be sound asleep, and I assumed he had stopped breathing. And I'd wake him up, and I'm like, it's dead, it's dead. And it's like, why do I think this cat is dead? Wasn't even my first cat, but it just was constantly overflowing. I think the cat died. It went on for several weeks until I kind of just calmed down and relaxed, and it was all anxiety and catastrophic thinking. And for us, all of us, I don't think we can or should turn that off, that hyper awareness, because we have to be super aware the pain might be serious. We have got to think the worst. We have got to go to the emergency room. We have to do these things. So you have got to keep it, but you have to be really aware of how it seeps into other thinking, not medical thinking, into thinking about your neighbor or thinking about anything going on could be just catastrophic, and you're not even aware of it. And it's catastrophic, but it's also just a constant anxiety. You almost have your shoulders like this. It's part of your catastrophic thinking, and you just have to relax and let a lot of information in and a lot of affirmation in. So I just wanted to point it out. The catastrophic thinking really, really spoke to me.
How about Elijah? Would you like to talk next?
Yeah, I'll go next. So again, diagnosis 2.0. So I would definitely say that again, I think I've shared this story with a couple people, or again, if you've seen my Instagram page, you'll see a couple things on there, but in case you haven't. So again, I was diagnosed, well, I just knew I had it. So my father, like I said, again, my father had it. He passed my freshman year of college due to basically like his heart ruptured, and it was too late to, like, I guess, revive him. But so again, but growing up, I was followed pretty close. Like growing up, I was followed pretty close. I had my first surgery at 17, and again, so even then, I was at a pediatrics hospital. Like again, it was different. So again, when I turned 18, okay, I'm off to college. When I turned 22, okay, I'm off to Texas, start life on my own. And so, but again, like I was pretty much still like in that as far as like diagnosis, being like, what am I trying to say? Diagnosis 1.0 when I moved to Texas at the age of 22, but it hit part 2 hit when I had my second surgery. I had in case you're not familiar, it's a AAA. I had a abdominal aortic aneurysm. I had to get that corrected. And apparently it's one of the biggest surgeries you can have as a Marfan syndrome patient, or probably anybody dealing with a heart chronic illness. And so it hit me. I was like, man, again, and at that time, he was just like, hey, man, if you would have waited till Friday, you would not be here. It was a Wednesday. I remember the whole thing, play by play. Drove back from Georgia for Thanksgiving. Pain Monday through Wednesday. I was like, I can't ignore this anymore. I went in Wednesday. They transferred me to a hospital, and everything was just getting realer, like by the hour. It was crazy. But so when I got out and I was finally able to like go downstairs, I had like a moment to where I was like, I just started crying, looking outside. Like it was definitely something different. And I was like, this is my life. So 2.0, like, again, it hit at that moment. Like I have to be less stressful. I have to be okay with not being accepted even as an adult. Because again, some like people still look at me and be like, I don't want to be friends with that guy. Because again, there's something going on with him. But again, I'm fine with that, and I had to find myself to become fine with that. And like I say now to a lot of people are gonna they're gonna be friends with you if they're gonna be friends with you. Like again, and I told my my girlfriend the other day, like again, I only have like 5 people that I call my friends because it's hard for me to get close with someone. And so again, like after that moment, 2.0, it hit, and I was just like, okay. So again, now I try again being an adult and having Marfan syndrome. I try to live stress free. Again, it's a blood pressure thing. Your blood pressure gets too high, something can go awry. I try to keep my blood pressure down. I eat basically no salt. I cook my food with no salt, and it still turns out great. So kudos to me. And I try to just live a happy lifestyle to where me as an adult, again, adults have more stressful moments. So anything that I can do to reduce that, I definitely try. So it's definitely been a struggle. But again, I have my friends, I have my family, I have my girlfriend, I have people around me that are concerned about my well-being. That helps the adult portion as easy as the child portion, as being a child, because again, as you're a child, everyone looks out for you. And then as you grow up, again, some of those numbers start to become less. But again, you find your good few becoming an adult. Diagnosis 2.0 can be a cakewalk in a sense. Again, you still have to look out for yourself. You have to know your body. If you got a chest pain, don't play with that. If you have a back pain, go look at that. But again, having those people in your corner to even, if you pass something off as, oh, that I'll be okay, and they come back around and say, nah, man, you should go and get that checked out. It's nice to have those type of people in your corner. So 2.0 is definitely, it has been hard, but it's been a good, because for me, I like knowing that I have people in my corner that help me to listen to myself when I don't listen, like something like that. So I would say definitely that it's a thing. And one more thing. So like, again, like I work out because I mean, it's like a safe space, mental therapy, physical therapy for me. So I work out a lot, but again, it helps me, I guess, in a sense that I'm normal. Because again, like Marfans, you really should be taking it easy. But one thing for me is I work out to feel normal. And so I do it, and I'm just gonna keep doing it. But that's one thing that really helps me as an adult and just coping with what I go through, the pains I go through every day, the pain in my feet and stuff like that, like different pains throughout my body. But I figured out something, and I think that's important in your adulthood, is to figure out something that helps you cope with what you're going through. So I'll leave it at that.
Appreciate both of your points. I think that, I mean, first of all, the major thing that we're talking about here between both of them is protective factors. I mean, it's having that, knowing that the catastrophic thinking, or however you want to refer to it, is a safety net. And same thing with social support. So I do want to emphasize kind of that mental health perspective. Those are protective factors. They help you function and continue to function and to keep yourself safe, but also to know that you don't have to do it on your own, that you can communicate and talk to others and find those people who are willing to listen to your needs and your current functioning and all of that. So I just wanted to jump in and say that, but thank you.
Elijah, too, I was noting, or I was thinking about when you were talking about how once you your brain had sort of shifted into that 2.0, it wasn't the first surgery. It wasn't the, even the first like big life event, moving off to college or whatever. It was just, I kind of think about it, and of course I'm not the medical professional in this, but to me it's like, it's when it all kind of coalesced between like your brain could finally digest it all and your body had caught up, and it was just like, whoa, this is the turning point. And it's interesting because I feel like for you, I've heard you talk before about like, you were trying, you wanted to be keeping up with the kids and like hanging out and doing all the things. And then it shifted, like, forget all that. I don't need it. And I feel like yours is one where it's like, it was almost like right here, put a stake in the ground. That's the turning point. And I'm sure it was more gradual than that. But, when it's coupled with a huge surgery, I suppose there'll be a little bit more of a jolt.
Yeah, it was, again, definitely a turning point. I think it made me, honestly, and I'm one of those people that I do pass off. I might feel something in my shoulder. I'll be all right. I might feel something in my leg. It'll pass over. But I think that particular experience, it made me stop ignoring. Like it really made me stop ignoring. And like a couple months before that, and again, this is just to go to show that in a sense, like you don't know what you have until like someone tells you, something like that. But like a couple months that May, before that November of my of that big surgery, the AAA surgery, I thought I had my first kidney stone, like passing of a kidney stone, because I woke up, I was in my dream in pain. I woke up out my sleep in pain. And at the time I was telling my ex-girlfriend that, hey, I don't know what's going on. I don't know what's going on. And then she's saying like, hey, it might be a kidney stone or whatever the case may be. And I was like, I don't know what that feels like. I don't know. So like 2 hours passed by of me trying to go back to sleep, and it's a pain in my back. And again, this is me trying to like, all right, it'll go away. And so the first time around, I went to the emergency room. The first time around, they're like, oh, it might be a kidney stone. Let's do a MRI, I think. And then the second time, like, oh no, you have a swelling in your, no, what do they call it? A dissection in your aorta. And I was like, huh? But, and I didn't know, but what that led up to was actually that November. But again, it can be one thing, but it's actually another. And again, those are the things like you have to pay attention to. Just again, coming into adulthood and just saying like, all right, you have to take care of yourself. Like you, again, and that goes, it goes about taking care of yourself. You have to take care of yourself. So I mean, again, I had to. I mean, I would say I made a change, but would say, I just listen more. Again, being an adult, you have to listen more to your body and be more proactive when you feel those cramps, those sharp pains. I mean, honestly, again, if you don't feel like going to the doctor, go on Google, but everybody says different things about Google. But if you type in something, again, you're not the only one going through it. And the details or description of what you feel, somebody's felt it before. And depending on where your mind is at, you can either choose to listen to what they say and how they cope with it, or go to the doctor. And I think, again, you have that choice as an adult. And so you should definitely, again, quote unquote, use it. So that's what I would say.
Thank you. Courtney, your thoughts?
Yeah, so kind of a lot to unpack here, but I think like Elijah, for me, it was kind of my first medical experience as an adult. So growing up, even before my diagnosis, I had a ton of surgery. Before I was 18 years old, I think I was in the OR 40 to 50 times. So I was very accustomed to having lots and lots of surgeries just due to birth defects, or, I had my aortic root replaced when I was 12 years old. So lots going on growing up. And so what happened to me is that I don't think I realized my diagnosis 2.0. I kind of didn't recognize that. How could I ever feel this way, even though I've gone through all this my entire life? And so I don't think I was aware of it. And so I let it really get to an unhealthy state of being in a panic and anxious baseline. My baseline was at an unhealthy baseline when it comes to panic and anxiety. And that probably hit me between 19 to 21 years old. And I feel like that time of life can be challenging for anyone, but then especially when you add on this extra layer of having to process your diagnosis and what this looks like going forward. So for me, had lots of experience in the OR, lots of experience with surgery. And then at 19, on routine scans, they found a carotid artery aneurysm. And I was booked to go back to the OR within 12 hours. They were like, yeah, we need to operate on that. And I said, well, I'm pretty sure that's been there for a couple of months. And they're like, what do you mean? And I was like, so it turns out I went to the emergency room in February because I had a really bad headache and a stiff neck on that side. And then like a couple of weeks later, I had this bump in my neck that actually has a pulse to it. And I went to the doctors, and they told me it was swollen lymph nodes and like it's probably fine. And so it turns out that I went from February to June with a carotid artery aneurysm, just hanging out for a little bit. And so I was booked for an emergency OR, and I was like, okay, it is what it is. We've always gone to the OR, we fix things, we move on. And about 6 hours before my surgery, the chief of neurosurgery in Boston called our cell phone and said, we're not going to do the surgery. And gears shift entirely. And so what happened is that a bunch of people got together and they said it's actually higher risk to intervene than it is to just leave it. And that it would be better to leave the aneurysm in my neck, knowing especially that it probably was there since February. And so for me, that was like a really big, probably stake in the ground moment, because I had to go from when something breaks, we fix it, to, no, something broke kind of, but we're just going to watch and wait. And so that was like, I think anyone would be anxious, but then my anxiety just took a jet plane and took off. And so from there, I think I honestly identify, looking back now, being, in my late 20s, that was my stake in the ground moment. I think that we kind of described with Elijah, that I was like, wow, this isn't going away. This is something I have to deal with forever. And now this is like a me problem. Like, how do I go back to college with this? How do I explain this to people? How do I, do my typical life? Do I do my typical life? I feel like I had all these questions swirling about future plans. And then I also faulted myself for feeling that way. I was like, wow, Courtney, you're really dumb. Why do you feel this way? You've had this your entire life. This isn't a shock. Like, deal with it. And so I think being able to give my self the space to say, no, this is me having to figure out how to own this as an adult and how to integrate this into my life. But that did not happen overnight by any means. That happened through a long process of trial and error, I would say. I went back to college that fall and I kind of had a different attitude of like, well, you know what? You only live once. We're just going to do this all and we're going to blow it out of the water, which might not have been great when I was taking organic chemistry 2 and trying to pass organic chemistry 2. But we made it through and we learned a lot. And at that time when I was probably trying to figure it out that most, I was very lucky, and my now husband came into my life and kind of gave me a centering point. And I think that's what Elijah was describing, when you have a meaningful person in your life that kind of has your best interest. My parents and my family have always been wonderful, but when you have that external person, that's kind of your external adulthood person, it does kind of make you rethink things a little bit. And I think that's part of the growing, and what does this look like as I grow, and having some help along the way. And I think the biggest thing is to recognize you are going to need help. No one should have to do this alone, and no one can do this alone. This is, whether that help is going to these webinars, or a really good psychologist, or awesome family support, or an amazing friend or cousin, or whoever it may be for you, you need help. And it's inevitable. There's, for me, I always was one of those people that I wanted to bear this weight myself, and I didn't want to have to put it on anyone else. And putting that, being able to come with terms that I can do this, but in order to do this, I need help. And so for me, what that looked like was kind of regrouping and saying to my own providers, they did not initiate this. I think I need to talk to someone. I think that this is too much for a 19 or 20 or 21-year-old or wherever I was to process on my own. And so I said, do you have any recommendations for a counselor or a psychologist or whoever that might be to kind of help me process all of this? And that was really, really valuable for me, was to be able to have a neutral third party that was like, yeah, this stinks, but let's talk about this part of it this week, and let's talk about this part of it next week, and kind of getting through why these other factors were coming out. So, my condition and dealing with my condition and my diagnosis 2.0 was seeping into other parts of my life. Like, I could not go in crowds without having full-blown panic attacks. So it was, and I didn't associate those two together. That was not there in my brain. I was just kind of faulting myself, being like, why is this happening? Like, never had this issue before. And so once I kind of was able to assimilate those two, I felt like it took a long time. It was not weeks, it was not months, it was probably years for me to get a grip and a hold and a grasp on things that I felt like I was at a really healthy balance. And I think that that's a challenge. And I don't know that anyone ever prepared me for that in the medical world or in anything. And so yes, I definitely faulted myself, saying like, oh, I've had this my whole life. Why is it a problem now? But I think when I took a step back, and now being a healthcare provider, and now being, in a relationship with my significant other, and having amazing friends and family, what it was is that when I got my diagnosis when I was 9 or 10 years old, there was all this support from my parents about taking care of a child with Loeys-Dietz, or taking care of a child with a connective tissue disorder. And there was support for me, child life care would come in and play games with me and make the medical stays better, and, those short-term things. But what happened is there was never anything that checked back in again after that. And so when I was 19 and 20, they just assumed since I had this my whole life, I was fine. And so I think that's what, is a really vulnerable time for individuals with these diagnoses, because there's just this perception of like, oh, this is your normal, like figure it out, it's your normal. And so those supports that are built in for parents when a child gets a diagnosis are not those same supports that are automatic for an individual as they come into adulthood. So I think that's why I'm really passionate about this cause, case, and everything that's enveloped in it. And I'm really grateful for Kristi and Brona and Elijah for sharing in as well, because I think those opinions and experiences are so individual and invaluable.
Thank you so much, Courtney. All that was very helpful. Oh, I'm sorry, Kristi, did you have something?
You're muted, Kristi. There you go.
Yeah, thanks. Yeah, I just wanted to add more about my diagnosis 2.0 because I was just talking a little bit about what you shared, I think. So I just wanted to add, if that's appropriate now. So because I was diagnosed as a child, I think it's interesting. My panic attack started at 5 and ended around 9. And it was this fear of the black hole. And it's the black hole. I always thought the black hole was death and me thinking about death all the time. And then I'd get too far down the black hole and couldn't get back and have a panic attack. But as I grew up, maybe closer to middle school, the black hole becomes a little bit more in focus, and it's the hole left by both of my parents, frankly. After my dad died, there was zero support for my mom. We didn't really know what VEDS was at all. And it was called type 4 Ehlers-Danlos syndrome. So it didn't really explain a vascular component. She just knew my dad's organ ruptured and he dropped dead at 31. And they didn't have high hopes for me living a long time either. So she didn't get out of bed for a year. And then we, after he died, and then she kind of got a little better, but not a lot better. So it was just me alone figuring a lot of this stuff out. And I kind of realized I didn't tell anybody about it in college. I was going to reinvent myself. All through school, I was the girl that didn't take gym class and kind of odd. Everyone, knew something was wrong with me, but we didn't know. I just didn't share a lot. And then in college, new person, nobody knew. But by the time I got to Chicago after college, I had to start building a new care team. I didn't really have one. And doing everything from scratch at 22 was so complex and so hard. And I kind of put together a practical guide for people who live with VEDS about what you kind of need to figure out when you become an adult or leave your parents' house. And there's like a short-term things like Miralax, everyday vitamins, exercise, these kind of things that we all know about and our moms tell us. And these aren't things that some things just us need, Miralax and ice packs, but everybody needs to brush their teeth and floss their teeth, right? But we really have to do these things. I've had so much dental work, for example. My teeth just started breaking off in college and falling out. And then you have to think about our long-term care, job choice. Where do we live after college? Do we have to be by a university hospital? Do we move to a big city? That's what I did to find good healthcare, but that's not for everybody. But a big city offers a lot of good things, anonymity, a lot of different people with different things going on. And so anyway, my 2.0, I can't really think, there wasn't a time as an adult that I was just so devastated. It was gradually that I came out of this big ball of anxiety and anger that I didn't really realize how angry I was until one day in my mid-20s, I wasn't angry anymore. And I had friends, I was going to music venues a lot. I had a job that had great health benefits, and it wasn't my dream job, but it paid bills and it was good healthcare. And I just focused on everything that I could do. And it really helped. It really helped a lot.
It's interesting. We hear so much in the community, and I know I've heard all of you say this, how quickly you must grow up as a child with VEDS or Marfan or Loeys-Dietz. And I think in Courtney, I really appreciated your comment about how, because there is that we say, well, you already grew up, right? But to Brona's point from earlier, doesn't mean your brain's caught up yet. You literally can't process that fully until later on. So I'm wondering, understanding that there isn't a cognitive ability until your brain is ready to really understand this. I'm wondering if there was an adult in your life that helped facilitate that, or if absent that, if you could look back and say, here's what I wish I would have had. Here's what would have been helpful as I was going into that 2.0 process. Because I know we have several parents and caregivers listening and watching with us here. And, we want to be able to help someone along, whether it's you're the parent or not, other people on that path, young people with these conditions now. What would you say they need, or what would you wish you had had as a young person? Yeah, Elijah.
I was about to say, I'll go first. So I'll say, so like, what I wish I had, I wish my dad was there to, like, if he knew about his diagnosis the way that he should have known, and to tell me about all the things on how to maneuver it, we would have been thick as thieves, close as thieves. But the story is, though, of course, again, my mom, she found out that, of course, I don't know how that story really went, but of course, she knows he had Marfan, had children, blah, 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 blah. My mom, she was on every appointment. She was on every appointment. She, without even having a computer, it's like she knew Marfan in and out. And just, again, she had 2 children with Marfan, so she was in and out the doctor's office, just making sure we were okay. And then informing my immediate family, like my 2 sisters are on here now, they looked out. They always looked out. And again, it was just more so like, we should know as much as we can, because we don't know what's next. We have to prepare ourselves, or whatever the case may be. Then finding out my brothers on my dad's side some of them had Marfan as well. Like, one of them, he helped me to cope with me having a chest that sticks out. I didn't know he had a chest that sticks out, but his is not as bad as mine. So he's able to more so blend with normal society and have that flat chested look going on, while me going through, honestly, my whole grade school and whole college, my chest is sticking out and I don't know how to cope with it. I'm wearing hoodies every day. Button downs aren't working, but he helped me figure out what clothes to wear. But again, now I get to my father, I'm thinking, like, if he knew, again, and I had this conversation with someone the other day, if he knew better, he would help me better understand and cope with what I'm going through. So I think, like, one thing that I needed was someone directly next to me going through the same thing that I'm going through, or helping me get through it. Because I think it would have helped. I really think it would have helped. I would have had better self-confidence, better self-esteem, better with the ladies. Like, I think all that stuff played a part on me not necessarily having it. My family, of course, they're concerned about me, but you're not going what I'm going through. Again, you don't feel the pain, you don't feel the bullying, you don't feel everything that I'm going through. You see the sad look on my face and you ask me what's going on. We have a conversation 30 minutes to an hour, and then it's back to your life and back to mine. Rather than, even again, it would have been the same with, like, my dad, or someone, not necessarily saying my dad, but, like, it would have been different, because again, you have Marfan, you live what I'm going through. Maybe you didn't, but I would think that you can help me maneuver through everything. And I didn't have that. So a lot of the stuff, like, again, how you just said, or how we've shared, we had to grow up fast. I had to figure out things fast. All right, if I wear a hoodie these days when I'm going to school, and I'm scoping out the scene and seeing that if anyone can notice my chest is poking out, I had a good day. If they notice it, I'm bullied for the rest of the day. So I just wish I had a person, like a Fairly Odd Parent or something, to just be right there with me, and just like, man, this is how you do this, and this is how you should do this, and this is how you should do that, rather than, of course, me figuring out myself. But again, I think I did pretty good trying to mask it and play it off, but I think that would have helped that much more if I did have that. So yeah, that's for me.
Yeah, I think a lot what you said, Elijah. I think in an ideal world, we all have a person or a twin or something, right? And so for me, my parents and my family, I'm a de novo, genetic counselor term here. I'm a new mutation, so did not get inherited from mom or dad. I don't have any siblings that are affected. So I've always been used to kind of being a little bit on my own, and being a little bit different from my siblings. My older sister, although she's not affected, was always my protector growing up. I would always be different or have casts or something, and we'd be out to dinner and people would stare at me, and she would stick her tongue back out at them when they were staring. So like even little things, she was my protector growing up. And my little sister, she was much younger than me. She's 8 years younger, but she would always just kind of hang out with me. she's and still is my person. So I'm very lucky to have family that's amazing regardless of their status. But I think that what have been most helpful for me going through this is that I wasn't able to recognize it myself, and neither were my parents. As amazing as they have been and amazing as they continue to be, they're super supportive and have been there every step of the way. I don't think anyone could say, hey, Court, this is like a whole new adventure for you. And how do we help you best? And so I think just, if you do know someone with one of these conditions, or you are a parent, or you are a friend, or you are someone, being able to identify like, yeah, you've had this for a while, but like now you have to face this in the context of what is you. And so, in my personal research and what I've done in graduate school and in my professional career, a lot of things that have come up is like, how do I think about this in the context of my condition going forward when I think about things and going into adulthood? Do I live alone? Kind of some of the things that Kristi mentioned. Do I live near a medical center? How do I advocate for myself? All of these questions start swirling in your head, and I think they become overwhelming, and are also another component in this anxiety soup that's kind of thrown at you. So I think that as far as who I wish could have been there, I think that I wish that someone said something sooner of like, I think that your panic and anxiety is a spillover effect of like dealing with the context of your condition as you approach like adulthood and in your independence. So I think that if there is someone in your life that's affected by one of these conditions, that's one of the best things that you might be able to do as they're going through their diagnosis 2.0.
Yeah, just to jump in on that, I relate to both. First, Elijah, of course. I mean, both my parents. I'd want two healthy parents. I had one parent that died, and then I look exactly like my father, and the other parent left alive, devastated, and I look just like him that she lost. So like, it was a struggle, and I was alone. I'm an only child, and my father was de novo, similar to Courtney. So there was nobody else in the family, and the only person like me in the family died, and it was like, oh God, but him for sure. My dad, I would take him back like in a heartbeat and figure out everything. What kind of music did he like? I like everything. But I guess I really didn't have, I had people, some adults in the family, and like, really random people. My mom was a single mom, so she kind of like left me places. I mean, like the waitress at Big Boy, where we ate every night for dinner for years, would take me, and this person would take me, this man would take me to Showbiz Pizza. And luckily I was pretty safe, but I think I became very independent and really strong. And I used to, well, regardless. So I really was in a very sad household, and I wasn't a sad person, and I was a child. So I just longed for happiness. And I think I really dreamt of growing up and getting out of the small city, I think is probably what really pushed me the most. So I was looking for something anyway. I had to get to college. And in college is when I really met my people, right? And we're all still friends. And I just started to feel like, oh, it's all right. Like, it's all right. I had all these 18 years that were so hard. And here I am at college, just like every other kid. And then when you graduate and you realize there's the only timeline you've ever been on is manufactured through a timeline of school and your parents. You're not behind, you're not ahead. You're just exactly where you are. And that's always good to think through too. And that's helpful. I forgot what we were talking about, really. Sorry.
I love it. Brona, did you go ahead?
Yeah, I wanted to jump in if that's okay. Yeah, and I think it's really an interesting concept too, to think about like being viewed as grown up, you know, because there's a lot of like capacity that you're not yet able or you have yet. So even if you grew up earlier, you felt responsible for some of your stuff, or you were on top of things, or you learned how to cope, or you at least appeared like you were coping. I think one important thing is to note that you're going to be reprocessing all throughout life and continuously attending to it. And you may be fine for one moment and not the next. And I think that's really important to note too. Like there's so much variability in life in general, but then add a condition that's chronic and random and does crazy things all the time. Like you're going to have to continuously fix and come back and address and all those things. But I think just again, on my mental health soapbox, I think that there are so many invalidating experiences when seeking a diagnosis and when acknowledging the emotional component, because so many times it's just attributed to that, or I'm hearing everyone speak and there's kind of this, I have so much to attend to, emotions is not one of them. You know, I have a lot of other things to do and I'm a child and I'm having fun and I want to do these other things. So your emotional well-being is kind of the last thing on the list. So I think it's also interesting to think about when you come to adulthood, like you're getting smacked in the face with all these transitions and these things that you need to attend to. And then you add this complexity of a condition. And there's just like so much more that comes up with it. So also just acknowledging that it's not always going to be linear and there's going to be ups and downs, and just continuing to attend to that. And also knowing that, yeah, like many have said, like you can ask for help, but also learning how to access those resources like support groups or connecting with your people in the community or seeking out those advocacy resources yourself. I mean, there's a lot of cool things that are available now that I like, especially these webinars and the foundations. Like I'm so thankful for those. Because just, you know, really quickly, personally, I grew up with, you know, a mother who had the same condition as me, but my mom was given a diagnosis in the time where you didn't know anything about the diagnosis. So it was like, oh, here's your label. Okay, that's it. You know, go off and live your life. And so I think too, like, just knowing for the younger generations that they have access to some of this stuff now. You know, they can seek out that understanding, or they can ask someone else to, whoever that person is in their life. But I think there's just so much more available now. And I'm very thankful for that. And I hope people utilize it.
Thanks for sharing that. I am wondering, kind of pulling from one of the questions that was submitted on registration, like some folks asked this question when they registered, and some of you have started to allude to it, but I'm wondering if we could clarify in on this too, and that is how to handle friendships or building friendships without people feeling like it's too much. So we're coming from like, I have so much to attend to, but I also want to develop these relationships. And you know, I think we've all experienced where people are like, that's too much. And, you know, how do we need to work through that? Because obviously we do need people, supportive people in our lives. And maybe those aren't the people, or maybe there's a way to help bring people in who feel like they are, you know, it's too much unknown initially. Yeah, Elijah, you're like, I'm on this one.
So I think for me, it's very black and white. And this is just coming from, again, being in grade school to becoming an adult. It's very black and white. Like, in school, he doesn't fit the picture. He doesn't look like me. I can't be his friend. Rather, and that's the cortex that was mentioned earlier. But again, that's that thinking process that's not necessarily developed as a child. It's not until you get into an adult into adulthood that I don't see anything wrong with him as long as he's taking care of himself. He's a good person. We could be friends. That might be my best friend. That might be my best man at my wedding one day, or whatever the case may be. And I think it's those two different things. So again, with it being black and white, even in adulthood, is either we're going to be friends and we're going to accept each other's physical and emotional / mental flaws, and we're going to work on them together, and we're going to keep checking up on each other, or we're not. And again, that's why I say I don't take the word friendship lightly. I check on those people, they check on me, and a lot of the times it's not a health talk. We're just talking about our day-to-days and our day-to-days and what we're gonna do tomorrow, what we have planned next weekend, next year, whatever the case. And when those medical things do arise, it's an open, very candid talk. And a lot of people aren't willing to have those, but when you find those people that are, that's it for me. So it's again, developing those relationships is important. You don't have to have a million of those relationships. And I think that was my concern as a child, rather than now. I value the friendships and that I had, the friendships and the relationships that I have now, rather than, like, again, it's quality over quantity. Because again, as a child, I just wanted to be friends with everybody, but nobody wanted to be friends with me. But now I want to be friends with the people that I see have a good heart. Like, that's it at the end of the day. And again, we still don't have to be friends, but I recognize the person that you are, and I'm coming to you and I'm approaching you for a reason. I think that we can be friends. Let's be my friend. We can be friends. And I still approach that at, like, today. Like, again, I see the good in people. I'm like, man, we should be friends. But again, I value those relationships because they're helpful, they're true to me, and they keep me on my toes, whether it's about my health or my personal life, or, like, again, anything I have going on. And those are the like the relationships that I care to develop and to actually, like, have in my life. So again, the relationship that you develop while living with a chronic illness is very important. So it's just like you mess with me, I mess with you. We're friends. We're friends to the end. So it's like that. And again, you're gonna find those good people, and it's always quality over quantity, especially as an adult.
Yeah, I can kind of follow up a little bit if you want, Elijah. So for me, I've always been lucky to be surrounded by a lot of people. My mom's one of 9, so I have 22 cousins that didn't have an option whether or not they got to hang out with me or not. So that was obviously a little bit of an advantage growing up. But, you know, as far as friendships and that goes, I changed schools between 8th and 9th grade, and had no friends. So I kind of started over in 9th grade, and then I moved from Massachusetts to North Carolina, and I didn't know a single soul in North Carolina when I went to college. So those were kind of all really big transition points in my life. And I found that probably until my early 20s that I felt this overwhelming burden to carry my diagnosis myself. So kind of keeping it bottled in and, like, not really making it part of our friendships, or not really incorporating that into a relationship, and kind of keeping it all to myself. Turns out not a great move. So for me, what kind of happened is, I think keeping that in did affect my relationships in a negative way. And so not being able to fully express myself, or not being able to fully people understand, I don't want to go out tonight because, like, my back hurts, not because I don't like you guys, but because I'm in pain and I just want to go to bed. And so I would say open honesty is important. I think that shouldering that burden on yourself and not being, disclosing that to friends or not talking about it is a lot on you and a lot on yourself. And you're not really doing anyone any favors there, because your friends can't be good friends to someone with a chronic condition if they don't fully understand what that chronic condition means in your life. So that's my first thing. And so I know that, like, what Angela described was, how do you make it not be too much for someone else, or how do you not scare them away? So first off, true friends you won't scare away. And I think that the other part of it is that that's too big of a burden to put on yourself. And so I really encourage you to not do that. And I did kind of shoulder that myself for a while, and I did kind of lose some friends because people didn't understand when I was maybe grumpy or didn't fully understand why I was not being the best friend back at sometimes, or, you know, because I had to do me for a while there. I was a little busy. So that's kind of my soapbox in that regard. But as far as friendships and relationships, I think that open honesty is a really big thing. And I think as far as being too much, it's one of those things where you have to understand that you have to tell people. You can't assume that people know. And so that's a really big thing as well. And I think I didn't realize that once I did share my diagnosis and did share what my everyday life is that I do have to kind of almost explicitly explain things for people in order for them to understand. And that's not because they don't want to understand. It's not because they don't care. It's because how do they empathize and how do they understand this world? They can only try. It's not tangible to them. And so that's kind of my other thing when it comes to friendships and relationships as you continue to grow and be in adulthood, is that I think that having an open and honest dialogue is the best recipe for success. And I think like what Elijah said is the true people will be there for you and they'll understand and they'll want to learn and they'll want to try and help you and advocate for you and be on your team. You've got to find your team. And whatever that may look like. And it's not an easy process, and there's definitely not a rule book for it. You got to kind of feel out what works best for you. But I just really encourage you not to shoulder that burden on your own, because that's a whole lot to carry. And there are plenty of people in the world that want to be your friend and that will be your friend and that will figure this journey out with you. And you will find your team. I can almost guarantee it. It might not be the easiest and straightest path, but that's kind of my 2 cents when it comes to that.
I guess I just want to add, I agree with what everybody said. Like each decade of your life, friends dwindle. But when you're young, they are very important. I mean, it's social networking is a big deal. So like, I was a very quiet, very shy person, even though it's very independent and all these things. So then you just kind of, as you're doing your diagnosis 2.0, part of having a chronic illness is becoming your own advocate, right? And so then you have got to learn how to talk out loud to people. So the more people you meet that are into things you're interested in, the likelier you are to make friends that last longer. I love painting, so I take art classes at the museum on the weekends, or little fun things where I can meet people that like what I like in my 20s. By the time you're in your 40s, you don't need any friends. So I thought. And then we moved to Baltimore when I turned 40, and moving's hard. I haven't made a lot of friends here because I don't work outside of the home, and you don't meet a lot of people like you do when you're 12. But I did start meeting people with VEDS, and those friendships are different. Those friendships are really special, like nothing I've ever felt like. We even look alike. I mean, it's beyond friendship. We're family. And it's been such a joy to meet other people with my condition in the last decade. So look for people like you, not necessarily sick like you, your interest, but of course, maybe if they have VEDS or Loeys-Dietz, that could help.
Thank you so much. All of that really good input. And I think, there's the caregiver relationship, there's the friend relationship, and then we've talked about like relationship to self on this as well. And, I'm really grateful for all of your candor in this. We've heard a lot. I've been seeing a lot of chats about how much this has been helpful and how much impact this has made. Before we're getting not all the way till time, but we're getting close. But I did want to give a minute to Courtney, because I wanted you to talk a little bit about the research that you were working on and some of those findings, because I think they're really validating to sort of like tie a bow on this as to, you and I talked about like, yes, this isn't fun, but it is normal. And there's no sense compounding those feelings with feeling like you're also some kind of doing it wrong.
Yeah. So in my graduate studies, I have a master's degree. I did research on specific genetic conditions, and what it's like to go through the social transition. So not the physical transition from pediatrics to adult care, but this social transition that you go through from your teens to your 20s to your 30s. And what does that look like for someone with a genetic condition that's going to span the lifetime? And then I actually pulled out my data and specifically honed in on Marfan syndrome in particular. I looked at other genetic conditions that were not connective tissue disorders, but then extracted my data for Marfan. And so for me, what I found is that there's this overwhelming amount of data that at our checkups and at our visits, we're getting asked about, do you have any chest pain? And do you have any back pain? And do you need an x-ray? And do you need an echo and a cardiac MRI? And all the things. Don't get me wrong, I work in the medical field. Those are super important and we need to make sure they're attended to. And if your doctor is not asking you those, I will honestly be concerned. But on top of that, we need to ask questions about how are you doing living your daily life? Because yes, we can be alive, but are we living? And how do we live with this? And so the biggest thing that I found is that there's this really unattended to information. And so when someone's going through this transition, any individual is thinking about really hard topics, right? So you start thinking about living on your own. How do you afford living on your own? How do you have the context of relationships with a significant other? Then you kind of add the other layers of family planning or not family planning and trying to avoid having a family, or your recurrence risks and pregnancy risks and all of these added extra infos. And then, you know, even earlier into the college years, you think about, can I have alcohol? Well, you're not 21, so you can't have alcohol. That's going to be the most answer that people give you. But can you have alcohol because you have Loeys-Dietz? That's not Googleable. No one gave you that information. There's a book on that, okay? And that might feel really uncomfortable and not something that you can ask your provider because you're not 21 and that's bad. And so you might not feel that ability to explore those things like any other 19 or 20-year-old might in college. And you might not feel comfortable asking those questions. And so you carry this extra burden with you and you carry this extra weight of how do I navigate these normal social questions, but also at this intersection of my condition. And that's so hard. Like I said, you can't Google it. There's no book, there's no handbook. And so those experiences are something that can also lead to mental health and anxiety because you're like, oh, I want to do all these normal social things and these things I'm supposed to be doing, but am I supposed to be doing it in the context of my condition? And so as far as my research goes, it's overwhelming that these things are not being discussed. Like, well beyond majority 50%, this is not even happening during a normal visit. And some of the barriers are that, like, you know, providers don't ask. Some of the other barriers are that parents are in the room and you know, young adults don't feel comfortable asking these questions in front of their parents. Some of these barriers might be that the visit wasn't long enough, or that wasn't the provider that they feel most comfortable with. And so there's a long list of things that are inhibiting the ability to get access to this information or get information on these topics or these matters. And so beyond, you know, we've discussed validating what do relationships look like and what does your diagnosis 2.0 look like. But I think there's also a really big fear of how do I go through these normal social transitions in addition to having my condition. And validating that space for someone, validating that space for yourself, your child, your sibling, your whoever it may be in your life. Yeah, adulthood's hard. Adulting's hard, right? We see all those memes and those funny jokes. But think about doing it and trying to have this added context of your condition. And so there's a whole extra burden and stress there. But I want to normalize that as much as we can for individuals in this community. And it's okay to ask your doctor. I remember being 20 years old and being at my neurosurgeon visit and being like, I'm going back to college. Can I have a beer? And remember turning bright red and like literally almost basically getting hives. And that's okay to ask. You have the question and permission and rights. That's your body and that's your experience and that's okay. And no one had ever told me that before. No one had ever said that. And so that's really something that I feel really passionate about. So maybe as a parent, you give your child space to talk to their provider by themselves. Or you say, hey, do you have questions about these things? It's okay to have questions about that. And so this diagnosis 2.0 is about you and figuring yourself out, but also giving yourself space to figure it out and giving yourself the education too. Because the only way to really kill it, rock it, find your team and find your place is to also educate yourself and what this looks like in that context. So that's really overwhelmingly what this research showed in simple terms. And hopefully it will get published, but more on the medical side of things so that providers are a little more aware too. That's the goal, is that it will get in a journal for providers that will be helping.
So we are at time, and I am sad to say that because I've really enjoyed this discussion, and I know our participants are really enjoying it as well. For the panelists, I hope you check in on the chat here. There's been a lot of really nice comments on how meaningful this discussion has been for those who have been listening and watching. I want to give Brona, do you have any other parting thoughts or comments that you'd like to share? And then I'm going to throw your contact information up in case anybody is wanting to follow up with you on anything.
Yeah, we have Elijah's information on there as well. I just wanted to, first of all, thank you everyone, and especially to all the speakers. All the raw emotion and the experience is really valuable. So I appreciate you all being here and contributing to this discussion. Oh no, that's not the updated one. That's okay. And I just wanted to also mention for the contact information, it's not for medical questions or things of that nature. It's just if you want to connect or get in touch, or for example, Elijah has an awesome Instagram, so you might want to check that out, especially if you have Marfans and are interested in that. So it's just more of a social connection. So we'll put that up there for that.
And I will throw the contact information into the email. You all will get an email if you, if you're here, you registered, you'll get an email out. I'll include that so that if you want to follow up, or if you want to follow Elijah's Instagram, it is a good one. I enjoy it, just to connect with more folks who can relate and are living a similar period of life or living similar struggles. So thank you so much to all four of you. I so admire your strength and your candor. I know these aren't easy things to just like open up and talk about. Brona, thanks so much for your detail and just like comprehensive look at this. And, you know, I'm personally not affected by one of these conditions, but I was totally relating to that content. Just, you know, it's just regular adult, as Courtney was saying, you know, too, it's just regular adult transition is hard. And there are lots of things that get reconfigured. And then you add on this extra layer and layers for many people. So thank you again. And yes, this will be recorded and sent out and be on YouTube, you know, forever, because the internet's forever. So
I didn't hear that.
And it'll just be the start of many conversations like this, right, Courtney?
Yes, many. This is my soapbox. So you guys will hear from me for a long time.
Very good. All right. Thank you all so much. Be in touch if you have questions, and yeah, stay well.
Thank you.